Good evening, everyone. It is Thursday, April 23rd, and I will start as I normally do with the statistics for the day. So I will mention that these statistics actually haven't yet been updated this evening. So what I'm telling you today is yesterday's statistics, and we should expect an update at any moment. I've been refreshing my browser to see if I could get the new statistics, but unfortunately they haven't yet posted. So to date, we have 4,851 test results returned. In terms of our total case count, we are at 194. That includes 99 active cases, 93 recovered cases, 2 fatalities still, and that adds up to the 194 total. In terms of the age ranges, we have 16 cases that fall in the 0 to 17 age range. We have 95 cases that fall in the 18 through 49 age range. We have 48 cases that fall under the age 50 to 64 age range, and then we have 35 that are 65 and older. Of the total cases, we are still trending slightly more female than male. So we currently have 138 cumulative female cases and 89 male cases. We are still definitely seeing it spread throughout the county with a concentration in the higher population areas of the central county. So right now, 20 from North County, 24 from South County, 16 in East County, and 15 from West County, and then 119 in Central County. Of the total, we are still actually seeing, I would say, a somewhat hopeful hospitalization rate compared to some of the more worst case scenarios that we've been hearing about from other jurisdictions. We have 22 of those cases have required hospitalization, and 172 have not required hospitalization, which is good news. We have, in terms of where that is coming, we are still seeing the majority of our cases coming from close contact with confirmed positive COVID-19 patients. So 42 cases have been travel related, 93 have been that close contact with a confirmed positive, 34 have been community spread, and 25 remain under investigation. I do want you to know that although the statistics haven't actually yet posted for this evening, I was actually on the phone with Dr. Mace earlier tonight, and she did mention that there were a substantial number of positive cases that had come in today just because of the result of aggressive surveillance testing that they're doing, especially as it pertains to close contacts. So we can expect to see, that number come up sometime tonight. I believe she said 22, but that should post to the website shortly as soon as they have the opportunity to categorize those and then get them loaded up onto the website. A few important updates from the county side of things. Number one, we do have our mental health warm line up and operating. If you are, feeling anxious or, just sort of struggling a little bit emotionally, please do call that warm line. It is open from 10 a.m. to 7 p.m., 7 days a week. I did have someone ask about, is it possible to have later hours, especially for some of us who have kids? You might need to wait until the kids are in bed. I will definitely look into that and see if that's possible. But for now, it's 10 a.m. to 7 p.m., 7 days a week. And the phone number for you to call is 565-2652. Again, that's 565-2652. I also want to give you an update on testing because everyone is interested in testing. We did obtain 5,000 new swabs, and we are expecting another 5,000 of the testing swabs within the next few days. That is just going to hopefully tide us over to the point when we get our big sort of score that we made, which is 100,000 swabs that we have on order. Once those 100,000 swabs come in, that's really going to be a game changer in terms of the ability to just stand up and really rapidly deploy that testing to the level that we want to see. So those 100,000 swabs that we have on order, that's going to take a few weeks, unfortunately, because that's that sort of larger scale order, and I believe that we're actually importing that, so it's going to be a couple weeks. But in the meantime, we do have the 5,000 and then another 5,000 that we expect in hopefully the next few days. We are also actually ramping up our testing capacity through our public health lab, which is great news. So this weekend, we're going to have our first ever drive-through testing. This drive-through testing is actually not for the general public, but it is for any healthcare worker in Sonoma County. And so that actually includes not just people who are, say, nurses or clinicians, but also janitorial staff or those who, come into contact with surfaces that they're trying to sterilize or, other people who might have contact with patients, front desk staff, that kind of thing. So any healthcare worker in Sonoma County can actually utilize that drive-through service, and so they won't have to wait. They can actually call ahead of time, so we can post that number for any nurses or physicians. I don't have that number right here because, again, it's only for healthcare workers. I want you to know the Emergency Operations Center is continuing to support childcare for healthcare workers. So we're continuing to sort of grow that capacity to ensure that anyone who has children, who are out of school and they need somewhere for their children to go in order for them to provide that critical essential service of healthcare work to the community, we want to make sure that they have an opportunity to go to work and to have their children in a safe and secure location while they do so. Finally, I want you to know that our Emergency Operations Center is also working on what we call COOP planning, which is continuity of operations planning at the county. And this is really, how can we as an internal county organization better serve you as the public, right? We have a lot of workers right now who are unable to fulfill and perform their essential duties, which is to ultimately serve you, the public. And so we're trying to figure out what kinds of mitigation measures will we need to put in place as a county, as an organization, kind of looking at ourselves like a business in order to keep both our employees and our clients safe and to reopen some of those functions that have been temporarily furloughed due to the COVID-19 pandemic. Also wanted to let you know that I heard some good news from Dr. Mace. I know that some of us are sort of nerds and we follow the R0 and the RT and sort of the transmission rates of the diseases in various localities and under various policies. And actually our shelter in place has been extraordinarily effective here in Sonoma County. And Dr. Mace actually believes that we push that R0, which is a sort of transmission or infection factor, over to a transmission factor of less than 1. So that's been really, really good, and we are doing a great job. And I know that everyone wants to know about, when are we going to get back open for business, right? It's a process. There are 6 indicators that the state has actually, listed that you need to meet these criteria before you reopen. And so we actually have been talking through with Dr. Mace which of those factors we have actually met those indicators and which we haven't. And so hopefully we'll be able to share more information with the public very soon with regards to our step. But one of the biggest things is that testing capacity. So we really need those 100,000 swabs to come in. We actually want to get to a point to where we can actually test around 800 people per day. And at that point, we'll feel like we're really able to get through all of those different priority populations and really be able to target and pinpoint where the virus is in our community so that we can aggressively perform those contact investigations and then quarantine and isolate those who might have the disease. And that's how we'll be able to get to more functionality in society and in our economy locally. So I will now go to what our questions are. And I did ask for some questions from Facebook up front. I did see someone says, "Are you nervous? Why are you talking so fast?" No, I just have family from the East Coast. I actually talk like this all the time. Not nervous, not even caffeinated. This is just how I am. So first question up was from Lena Girardelli, and she asked, how and where can I protest the county's overreaching orders? Ultimately, protest is your decision, but I do want to take the moment to say something. And that is that I do not know a single official that represents our county, whether they are, hired by other elected officials or whether they are, ultimately hired by the public through the democratic election process, that wants to shutter our small businesses, that wants to devastate our local economy, that wants to sort of send people home when they want to be at work, that wants to shut down our schools. These are really hard decisions. And at the end of the day, we are literally balancing lives and jobs and lives and income. This is not a sort of simple math, and I recognize that this is a huge struggle for everyone, but I just want you to know that these decisions are not, like someone sitting up in the middle of the night thinking, how can I make a bunch of people really, really miserable? This is ultimately a huge challenge. We have people who are vulnerable medically, right? And those are some of our seniors. Those are people who are immunocompromised, who have co-occurring medical conditions. And then we have people who are vulnerable financially. And those are some of the people who are in the hospitality industry. Those are, some of our minimum wage workers. Those are people who had to shutter their small businesses because they were classified as non-essential. And all of those people are important. And it's a really, really, Dr. May says, I think one of the toughest jobs right now, which is how do you balance those priorities? How do you keep people healthy? And how do you also keep them, fed and clothed and in houses, right? Which requires either an income or a lot of social service work. So I just want to acknowledge that this is something that is very challenging. And I think that anyone who is in a leadership position right now, myself included, even though I'm not the one making the final decision, is losing sleep over how can we best protect our community? How can we best take care of our community? And we're also trying to source, what are the different ideas that you have? What are the ways that you might be able to reopen your business but have really stringent, public health mitigation measures that will keep your employees and your customers safe? So we're having those conversations, but I do want you to know that we are working very hard night and day, 7 days a week to try to keep people healthy and to try to strike that really challenging balance. So yeah, what you do, what you say, that's up to you, but I just want you to know that there are a lot of good people who are trying as hard as they can to try to keep people safe. Good question from Carrie over here. Is there a timeline to reopen our parks, or is that still to be determined? Yes, we are actually anticipating a change to the public health order regarding parks to take place next week. So I'm hoping that in the next few days, I will have more information, but what I last heard from conversations with Bert Whitaker, our regional parks director, is something that I've shared in previous fireside chats, which is that we're anticipating an order that would look more like Marin's order. Marin actually had an order wherein they allowed parks to be open for those who could walk or bike to their park. So more like you could go visit your neighborhood park, but you couldn't, travel across the county to go to your favorite park for a hike. And I recognize that this creates equity issues and that not everyone, is comfortable biking. Not everyone is lucky enough to have a park within walking distance. And so, we are working on what would the next phase of a park soft reopening look like. But for now, it looks like we will hopefully have, a revised public health order sometime next week. And we can anticipate you being able to walk or bike to your parks. And also we would expect the current prohibition on cyclists on our class 1 bike trails. So that would be like the Joe Rodota Trail or the West County Trail, for that to be reopened to cyclists again, I believe. Last I heard. Could change, so just wanted to let you know that. All right, question on, will the county be looking into more ways to support local businesses in order to stop them from closing? And this is from Lindsay Rose. With most families losing money each day, to feel like there will be a decline in sales and orders as we lose the opportunity to pay for their services. Yes, we are absolutely looking for ways to support our small business community. And I've been in multiple conversations with our fantastic, amazing Economic Development Board Director, Sheba Pearson-Whitley. She is working hard to come up with ways that we could help small businesses, including she's actually trying to stand up a small grant program, which, we don't have a source of funding yet identified, but she wants to do something that's very similar to what the Santa Rosa Metro Chamber did, where it's just about getting some money into the pockets of our small business owners so that they can hopefully weather this storm and reopen when they are permitted to do so. She's also looking at standing up a small business resource center, which actually we already have a lot of that capacity. If you go to the Economic Development Board website at the county, you can actually give a phone call, get straight answers to your questions, and have an opportunity to talk to an economic development expert who can guide you to the various resources, whether they're local, state, or federal. So we are definitely thinking about our small businesses, and I recognize that this is an extremely challenging time for our small businesses. And our small businesses are really, truly what makes Sonoma County great. I can't imagine any of our small rural towns without the amazing restaurants and coffee shops and little retail stores. So we've absolutely got to fight for them, and we are going to work hard for them on the county side of things. Judy asks, is the not traveling across county lines being enforced in any way? No, there is not currently enforcement with respect to not crossing county lines. Again, the only reason that you would travel out of county right now is supposed to be for an essential activity, which pertains to an essential business as defined by either the state order or the local order. But at this point, we are not seeing, CHP or sheriff's deputies or any other law enforcement actually stopping people to determine whether their purpose is essential or non-essential. We are just telling people to do the right thing and hoping that they will do the right thing. So let's see, other questions. Curious about limited park openings progress. I did cover that. And there's a question here also about the idea of odd and even license plate ideas. Those are the kinds of things that we are exploring for what could potentially be a phase 2 of, further parks openings. Right now, we're just starting with giving you access by either pedestrian or cycling access into our local regional parks. So when we start thinking about more, you could go someplace else, that will probably require further mitigation measures and certainly some, traffic and parking controls with our park rangers and potentially those kinds of odd or even license plates and different days and that kind of thing. All right. Questions. Only 152 test results today. when are you going to start testing the general public, i.e. possible asymptomatic individuals? We have been waiting as nothing should reopen until these results come in. And this is a great point. And the point is that you cannot really robustly reopen businesses until you have stepped up testing capacity. So we want to get to the point where we have about 800 tests being run each and every day. And there is actually a priority tiering system that comes out of the CDC, the federal level, right? That tells you sort of what the different priorities for testing are, right? So first you want to look at healthcare workers. Then you want to look at first responders. Then you want to look at essential infrastructure employees. So those would be potentially your grocery store clerks and maybe some of your county employees who are not, in clinics, but are still serving customers on a daily basis. These would be people who are distributing food, people who work for Ceres or Food for Thought or some of those wonderful local nonprofits who are making sure that everyone stays fed and healthy during this pandemic. And then after that, sort of the last tier that's identified by the CDC is anyone in the community who has some symptoms, right? And that we have to recognize that, especially as we head into later this year, right, heading into the fall and winter months where, the flu season starts to pick up, there are a lot of things that can cause a fever. There are a lot of things that can cause, coughing or other COVID-19 symptoms. But we want to get to a point where anyone who has any kind of symptom can get a test. And we are not quite there yet. But I do want you to know that we are currently testing asymptomatic individuals who are close contacts of confirmed positives, as well as healthcare workers and other high-risk sort of scenarios, including folks who are in skilled nursing facilities, inmates in the jail, and also our employees who work in the jail, as well as homeless encampments where we know that the virus could spread very rapidly. So we are working on the asymptomatic testing, but we want to really, we need to step up our testing capacity. Oh, one thing I also forgot to mention is that I did learn today that both Sutter and Memorial now have a 90-minute test available. This is a really important thing, and we are trying to get the rapid testing at our public health lab as well. This essentially means that if you go to the doctor, right, and you have symptoms, and you could actually be there waiting for the test results and get them in real time, as opposed to being sent home and told to self-isolate and waiting for the test results then. So it's actually a very, very positive development to have two labs with that capacity right here in Sonoma County. All right. Question, what are we who live and work on the coast supposed to do? We are barred from going to parks within 5 miles from our homes and businesses. Why can't we open the beaches to locals? People need to get out and enjoy their lives again. I understand that intense frustration. At this point in time, I have not heard about plans to reopen the coast. The plan that I have most recently heard is that the coast would remain closed. And I recognize that this is challenging for locals who live there, but what we have seen is that anytime we get sort of the slightest crack in the window around the coast, that people pour in from out of the area and flood the beaches and create a very dangerous situation with respect to public health. I can tell you that we've been averaging about 1,000 people per week that have received contacts from local law enforcement agencies or park rangers who are trying to visit the coast illegally right now. And of those roughly 1,000 per week, 95% of them are out of area visitors. And so, that's why it's been a challenge, even when the coast is completely closed right now, to still control the crowds of people who are trying to get there. So if anyone has suggestions or ideas, I would be happy to funnel them to Bert Whitaker, our regional parks director, who is also coordinating very closely with state parks, because we have both regional and state parks, of course, along our Sonoma County coastline. All right. I am looking for more questions. Question about unemployment. So many have not received it. It's been 6 weeks. What is going on with this? This is extremely frustrating. And I know that the state is really working, and that the governor has, kind of put plans in motion to actually really beef up and hire more people at EDD to be able to process all of the unemployment claims. Also, a quick reminder, by April 28th is when, if you are self-employed or an independent contractor, that you will then actually have a process open to you to be able to file for unemployment. And that will allow you to collect that $600 a week that was approved by the federal CARES package. So I will definitely pass on the feedback regarding unemployment to our state representatives and see if I can find out what's happening with some of the people who have not received their checks yet for 6 weeks, because that's really, really hard. And it's very challenging right now, obviously, to try to pay your bills and buy food without being able to receive that unemployment check. All right. Question From Cheryl Deem, I am unclear about what asymptomatic means. I know it means that a person has been exposed to the virus, has or had it, and doesn't exhibit any symptoms to self or others, but can nevertheless transmit the disease to others. But how long does the virus stay in an asymptomatic person? Is there a time when it will run its course silently and unknowingly, or does it stay within the infected host indefinitely? This is a great question. I will follow up with Dr. Mace on this one. I simply do not know the answer, but I will definitely ask. Oh, and I forgot to mention, I did get an answer on one of the questions from last week, which was how do we define recovered? Because we have that little category on the socoemergency.org dashboard that's, recovered. And what that is defined is by 7 days plus 3 days of being asymptomatic. So you've got to go sort of 7 days from the date of the test and then also have 3 days of having no symptoms of COVID-19. And at that point, you are considered to be recovered from the disease. And then I did not, unfortunately, get an answer yet back on whether Recology can stop picking up your trash if you don't pay them. So I have County Council looking into that, and I will let you know as soon as I know. That was one of the other outstanding questions from the last Fireplace Chat. All right, I will look over to Emmett, who has hopefully been looking through some of the questions that are coming in, and I will open it up to questions from the live feed because I've gotten through the ones that were posted ahead of time.
Yeah, I'll give a selection. So somebody's asking for how many active cases rather than cumulative, how many, and maybe refer them to the SoCo emergency.
Yeah,
dashboard.
so someone asked how many active cases do we have? Right now we have 99 active cases, and if you want to track that, if you go to socoemergency.org, and then really the one that I really like is scroll down that page a little bit and then click on the COVID-19 dashboard, and that will take you to the one that has all of the detailed information, including what the symptoms are that people are experiencing, where they are, gender, age, all of that stuff.
What is the policy of the Sheriff Department in contact with folks that are homeless in West County? Have heard reports of asking folks who are not breaking the law to disperse, worried about scattering COVID risk.
Question is, what is the policy of the Sheriff Department with respect to unsheltered people in West County? My understanding is that the Sheriff is following the guidelines that were established by the CDC of not scattering in homeless encampments. That right now, to my knowledge, again, is a county-wide policy for all law enforcement agencies. So the City of Santa Rosa is following that. The Sheriff is following that. We are not dispersing homeless encampments because it does increase the risk of transmission of the virus. However, I do want you to know that we are proactively trying to get people into shelter. And this week alone, we're hoping to place 50 people who previously have been, living in encampments, actually into both the trailers at the fairground, as well as so that would be 20 people at the trailers at the fairground, and then 30 in our first pod at SSU. So Sonoma State University, we are actually taking people in kind of groups. So about 30 people, and it's sort of, we're just calling it a pod because it will have one care provider, so one service provider who can meet the needs of the unsheltered folks who are being moved into this particular area, sort of particular part of the dormitories at Sonoma State University. And we are prioritizing those that are at highest risk of complications from COVID-19. So people who are 65 and older or who have a co-occurring medical condition. All right, next question.
How can we enforce people coming from other county into Guerneville? I've had people coming to my work from other states in San Francisco when they're shelter in place.
Question, how can we enforce people coming from other counties and actually even other states? Someone is saying that they are experiencing in Guerneville, people coming from all over the country, it sounds like, to come and visit. I really think, this is one of the reasons, and I know it was a controversial issue, that I supported installing these signs along the side of the road, because there are people who seem to be completely clueless about the fact that really only essential activities are supposed to be conducted right now. And it's not the locals, it's really the out-of-towners who are coming and sort of acting like we are in a business as usual scenario, and we are not right now. So we can continue to work with our different tourism partners, and we can continue to try to push out the message via social media, via public service announcements, radio, print, and TV to try to get the word out. There isn't really a mechanism at this point for, just enforcing someone who's walking down the street, that happens to be from out of the area. But we can actually target vacation rentals and Airbnbs and motels that would be operating in violation of the shelter-in-place order. So if you know of any location that's actually hosting out-of-town visitors who are just here to try to, vacation in the midst of the pandemic, please do report them to the local law enforcement non-emergency phone number. And so in an unincorporated area like Guerneville, That would be the sheriff's office, and the phone number is 565-2121. You might hear some murmurs. We've got some, I call them zombie children. They're supposed to be in bed and they keep coming back out like zombies when they're supposed to be asleep. Anyway, husband's got the next question.
Is it likely we will all eventually catch the virus, or is it reasonably possible to avoid it?
This is an interesting question. And the question is it likely that we will all eventually catch the virus, or is there some way that we will be able to avoid it? So I actually was listening, and this came from the radio, not from Dr. Mace, but today about, this sort of think that the tipping point in terms of developing herd immunity might be somewhere around 70%, right? At which point it becomes more difficult for the virus to transmit because some of the people that it's trying to transmit to have already had it and are therefore immune. So there are basically two ways that we get out of this thing and back into a normal level of society. One is we hit whatever that magic number is, somewhere in the range of 70%, but it might be more than that, right? We don't know for sure. We either hit that herd immunity point or we develop a vaccine. And so the question becomes, which happens first? And if we were to try to rapidly achieve herd immunity, that's something that the UK considered, but they quickly realized just how devastating that would be. Because the amount of sort of unnecessary death in people was just way too much to consider that course of action. And so that's why you see countries all around the world really trying to aggressively follow shelter in place, and then to try to gradually loosen the restrictions on society and on the economy while ramping up testing and really ramping up the contact tracing. That's how we're going to really get our arms around this virus, is that anytime there's a positive, you immediately investigate every person that has been in close contact with that confirmed positive. And then you don't just identify them, you actually quarantine them and require them to self-isolate. Because personally, I would rather self-isolate for 2 weeks because I had been in contact with someone who was positive than for every single person to self-isolate indefinitely. So that's really the point at which we turn the corner, is when we really are able to have enough testing to go after that aggressively. Next question.
Are there FEMA or SBA loans available for a bar that is closed?
Are there FEMA or SBA loans available for a bar that is closed? Yes, there are SBA loans available, and there is also the PPP just got re-upped. So the PPP is the Paycheck Protection Program that was issued by the federal government that unfortunately ran out of funding the first time around, but they did just replenish that pot of funding. So if you are the owner of a bar that is closed, please reach out to me. I can refer you directly to the Economic Development Board, and actually I can probably even pull up that website and see if I can get that phone number for you right now, because I think it's right there on the, so it's sonomaedb.org is the website, and there's phone numbers all over the place. So you can call any one of our specialists. If you want to talk to Marco Suarez, 565-6402, Lauren Cartwright, who is Business Retention and Expansion Program, 565-7298. They will get back to you. They really, really want to help you, and we'll make sure that you're connected to the resources. Next question. But again, that's sonomaedb.org, and all of the information is right there. If you go, the landing page says, click here to view our coronavirus business resource guide, and so it will direct you to different resources that can help you weather this crisis.
Someone comments, if we're required to wear masks, we need affordable access to acceptable masks. Do you have any?
This is a great comment and question, is that if we are required to wear masks or facial coverings in this case, which is what we're calling those cloth masks, that we need access to affordable options. The city of Sebastopol is stepping up. They actually ordered 500 masks, and they're going to have them branded with the city of Sebastopol logo. And rather than the police, fining people if they see someone walking around without a mask, they're actually going to offer them a mask. So if anyone has a hard time affording masks, I'm actually looking into this for the county side of things and hoping to place an order so that we would be able to distribute them to people in need. We also have some awesome local volunteers who are stepping up and sewing masks and giving them away via social media or via other service providers. Latino service providers offered a stand-up pop-up mask free giveaway last Friday in Roseland. And so please do reach out to me, District 5 at sonoma-county.org or linda.hopkins@sonoma-county.org. And I would love to see what the need is in terms of masks and see how or facial coverings, the cloth masks, and then see how we can help you afford that.
At this point, do you sense we will be sheltering in place through at least the end of May?
Question. At this point, do you sense that we will be sheltering in place through at least the end of May? What our current plan is, this is in conversations that I've had with Dr. Mace, is that we are planning on aligning more closely with the governor's order this time around. So we will be expecting a change to the public health order, again, probably next week, that will actually relax some of the restrictions in Sonoma County, but really we're ultimately under the state shelter in place model. And that is, we can't go more lenient than the state. And the state's shelter in place order does not have a sunset date. And the governor has given no indication that he plans to sort of terminate that early, right? Sort of in the near future. He keeps talking about every time someone says, so are we going to be sheltering in place for the end of May? Or are we going to be sheltering in place, through the end of June? He will say, I have 6 indicators. We have to meet the 6 indicators, and then we can move forward with relaxing the shelter in place restrictions. So my sense is that, through the month of May, we will be in some form of a modified shelter in place. Will it be as stringent as it currently is? I certainly hope not. I hope that we are able to gradually loosen some of those restrictions, and we are making lots of plans right now on how to implement best management practices or what kinds of protocols could be put into place to allow some of our small businesses to reopen.
Any thoughts yet on how schools can safely open in the fall when we will likely see a second surge, staggered times and days, continued partial distance learning?
This is a great question, and this question is, do I have any idea about how schools could potentially reopen in the fall? And exactly what the commenter said is the conversations that are taking place right now. So, staggered starting times. I think that in many instances, this becomes a little bit easier for some of the earlier grades, kindergarten, first grade, second grade, where oftentimes you spend the vast majority of your time with one teacher anyway. I think it becomes more challenging for high school and for, grades that have sort of different periods, right, where you're going through a different teacher each time, because a lot of the best practices around controlling the spread of COVID-19 in students, we're actually already implementing this with respect to childcare and preschools, right? So it's keeping a small number of students and keeping them in the same group of students. So they're not actually interacting with other students. And so you would have the same teacher and the same students, and you would try to almost create like these pods again of sort of children that are kind of, touching each other, and they're part of their own sort of close contact group, but they're not then interacting beyond that group. This becomes extremely challenging, and I've heard from a lot of, quite frankly, panicked school district board members who have no idea how they could possibly implement this on the shoestring budgets that they're currently facing. Our schools have been underfunded for years, and then the thought of having to have, a sort of different student-teacher ratio and potentially, complicated schedules in terms of staggered start times and, different lunches, lots of more sanitation work, right? So increasing the janitorial workload for the school districts is very daunting. So I think a lot of work is being done on that right now to try to figure out what that could look like, and more importantly, who's going to pay for it. Because I know that, a lot of our school districts locally struggle, quite frankly, financially, to even sustain the level of schooling and the level of teachers and staffing that they currently have.
Any update on antibody testing?
Any update on antibody testing? Great question. So we have placed an order for antibody testing. We have not received that. We have not received confirmation of when we anticipate delivery of the antibody testing yet. But we certainly want to know what the level of antibodies is, which gives us a sense of, what's the prevalence in the community of people who have already had it. I don't think that we're anywhere close to having those levels of herd immunity. And the different reports that I've been hearing from other countries, from other states, show that there isn't really anywhere in the world right now that is close to that level of herd immunity that would effectively, limit or reduce the transmission of the disease.
Can you let anyone in, this is Jennifer Wertz, let anyone in the Lower River area know if they need emergency food, call either local taxi to get on the list for Wednesday deliveries from the RFUV or the WorkFit and the Workforce Fund.
Great. So awesome comment from my friend Jen Wertz, who is an amazing Municipal Advisory Council representative for the community of Guerneville. She said that if you live in the Lower Russian River and you are in need of food, you can call to get on the list for Bill's Taxi, which is actually delivering some of the food that's being supplied by the Road Empire Food Bank and other distributors actually directly to people's homes. And you can also call the Russian River Alliance, I think. Is that what she said? To go to the Russian River Alliance also, I know, has a Facebook page. And so you can definitely always communicate with Jen that way as well. But we do have resources available, and the Russian River Alliance is a great one. And hopefully we're gonna get them a little more funding from the county to keep doing the great work that they're doing, keeping people fed and keeping people, they've in the past have also helped with emergency rental assistance for a lot of our workforce in the lower Russian River. So thanks, Jen, for all of your fantastic work, and look forward to continuing that work.
At what point are we going to acknowledge veterinary medical workers are healthcare workers and should be eligible for testing?
This is a great point, and this question is, at what point are we going to acknowledge that veterinary workers are also healthcare workers and they should also be prioritized for testing? I will follow up with Dr. Mace on that one. I would think that at the very least right now they would be considered sort of in that tier of essential infrastructure workers, which would mean that they are next on the priority list after the healthcare workers. But I will ask her if we can get veterinary workers included, because you are also obviously coming into contact with a lot of people, because they don't just, pets don't just drive themselves to the vet's office. I recognize that. So I will definitely follow up with Dr. Mace and write that one down as something to follow up on, and hopefully I can get you more information next week. Other questions?
I'm just looking.
All right, my husband I know is rapidly scanning, so we'll see if we can get one last question and then maybe call it a night. I'll try to scan too. Let's see. Actually, this is a really good question. I see, what is the point of a county order if we have a state order? And I can actually answer that one because we've had a lot of conversations about this. Ultimately, again, we are all bound by the state order, which is a state shelter-in-place order. The problem is, if you have read the state shelter-in-place order, you would know why we need to have a county order. It's incredibly vague, and all it does is point to the Cybersecurity and Infrastructure Agency at the federal government, which defines fairly broadly essential and non-essential businesses. That order, because of the way it's written, is not something that our local law enforcement agencies can actually interpret. Neither could our small business owners. And a small business owner, when trying to determine, whether they're in compliance with the public health order, is not going to pick up the phone and call the governor's office because there is no one there to answer those kinds of questions. They're going to pick up the phone and they're going to call either the city that they live in or the county that they live in. And so the reason that we have a local health order, even if the whole point is to reflect the state order, is to make it more specific to our local jurisdiction so that we actually have more specific information for our businesses, for our residents, and for everyone who is ultimately tasked with following that order. So with that, I'm going to say goodnight. I'm actually getting a phone call from our representative, State Senator Mike McGuire, and so I'm going to take that, and I hope that you all have a good night. Stay safe and be well.